During the pandemic, restrictions were put in place to limit the number of people on maternity wards, meaning that pregnant women often had to attend scans and hospital visits alone.
Well, yesterday we asked you to share your stories, and here are just a few of them.
I had a baby at 26 weeks. She was £1.5 born, and she spent 4 months in hospital. I was completely on my own.
After a long and complicated labour, it resulted in an emergency caesarean section. My husband had to leave a few hours after giving birth.
I went through a ruptured ectopic pregnancy alone. At 2 hours post C-section, my husband had to leave the hospital, which was a highly distressing time for me, as I couldn't even pick her up to feed her.
The whole of my pregnancy this year, I haven't had my partner at any of my scans or appointments. I see people getting drunk, having fun, doing whatever they want to do, and my partner can't even come with me to an appointment.
Well, since lockdown restrictions have slowly lifted, it's been reported that nearly half of hospital trusts are still imposing a ban on partners attending either labour or scans.
Well, Dr Larisa joins us now to explain a bit more. Thanks, Larisa, because it's quite confusing, the state of play at the moment, because it changes depending on where you are. So just sort of tell us what's happening now.
Yeah. So initially, when restrictions were brought in, it was for a combination of reasons. The main reason being to sort of protect any woman coming in who was pregnant. We know that pregnant women still continue to exist in the vulnerable group. So it was done in order to try and prevent the spread of infection and any woman getting COVID. It was also done to try and protect services within the NHS that we knew were going to be redeployed towards dealing with the crisis. But now that we're through the worst of that peak, actually adjustments have had to be made. And you've seen from the videos, there's a real need for this to occur. We're at that, Boris Johnson talks about that critical tipping point. And that's where we're at when it comes to mental health, and especially mental health affecting pregnant women. So the fact that we now have lots of regional differences in terms of lockdowns means that there are huge regional variations in terms of what hospitals are doing and how they're restricting partners and other birth advocates from being able to attend with women to their appointments and to their scans, and lots of women are missing out.
Well, there is this inconsistency, and this is what we hear so many times, and it would be so much better if there was clarity. Yes, we are 4 individual nations that form the UK, but having this mixture of information is really difficult. Wales, Northern Ireland, current government guidance states you are allowed to have 1 person with you during labour. Scotland, you should be able to have a second birth partner if you want. You can have an additional designated visitor after the birth. Across Scotland, you can now choose 1 person to attend all your appointments with you. In Wales and Northern Ireland, national guidance states your birth partner can come with you to 2 key scans at around 12 and 20 weeks. Yet here in England, NHS England issued guidance to encourage trusts to reintroduce access for partners, visitors and other supports and pregnant women. But it's a postcode lottery. It's not happening.
Completely. And the postcode lottery is what we see with IVF. We've discussed that before on the show. And that's exactly what's happening here now, that actually women are finding themselves deprived depending on where they live. So actually what that's leading to is some women potentially moving across to different parts of town or different regions in order to try and book at different places. But actually the hospital that they book at may be quite far. So if there's a complication that they suffer from and they need to go to that unit, it's impossible for them to get there, and their care can become severely compromised as a result.
And also, you know, the fact of the matter is, sometimes when you go to these scans, it's not going to be good news. And this isn't just, you know, this isn't just normal pregnancies. This is women who may be having a miscarriage that are coming in, that are having to deal with this on their own. Like, the implication of this for a female going through something like that, or receiving some bad news they weren't expecting, to be able to, at any time, is horrific. But to do it on their own, it's just awful.
It's unbearable. It really is. And I think, you know, being pregnant and facing the prospect of being a new mum is challenging at the best of times for all sorts of different reasons. And when you throw in the pandemic and the deprivation that that's causing, the fact that you can't have your partner with you helping to advocate for you, you can't necessarily have your doula or anyone else who's supposed to be supporting you, like your sister or your auntie or whoever the nominated person is. It's just so awful. And as you say, when women in particular are about to receive or do get bad news or are told there are abnormalities, having to deal with that and not being able to, you know, so much as a health professional, comfort them, put an arm around them, hug them. You know, there are times when, as you know, I've worked in ICU during the pandemic and I was wearing my PPE, and there are times I will openly admit I did reach out to hug people because I had to. It felt inhumane not to. And we're having all of these restrictions imposed on us. We understand why they exist, but actually there's no fairness, there's no consistency around it.
There are stories of women going through the emotional, physical trauma of a miscarriage, and their partner is sitting in the car park outside. Now, that is one of the stories, but all of the other stories, the ones that Holly was mentioning then, this is all part of the seeds of trauma that could last forever.
Absolutely. And we know that 1 in 7 women, on average, outside of the pandemic, suffers from anxieties when they're pregnant. Now, can you imagine how many more we're going to see as a result of the pandemic? Already, with a recent survey that's been done, it's been reported that over 75% of women have faced anxieties, which can lead to severe depression, which can lead to post-traumatic stress disorder. And as a result, one of the leading causes of death, actually, in new mums is suicide. And I have personally seen some women driven to this, just absolutely driven to be beside themselves in terms of not being able to have any support, not knowing what to do, being without the finances to support themselves because their partner's lost their job and they can't go in, not being able to provide for their children, not being able to breastfeed because actually they have to homeschool their other children. That's been a common thing that's happened in the pandemic. They're just not getting the support that they need. And actually, we have to face facts that mental health is at that tipping point. And unless something is done to actually change this and we provide consistent laws that have to be maintained and respected by every hospital, and the government helps every hospital and unit to provide this.
The rise in free birthing, so explain
free birth. So one of the things that has occurred as a result of the pandemic is that some women have decided to take control and take matters into their own hands because they're worried about the prospect of going into hospital, they're worried about the risk of infection, and also they're worried that they won't get the support that they need. So instead of birthing in the hospital or a midwife-led unit, they've actually decided to free birth at home without necessarily a midwife there or someone who understands the process of labour, which is incredibly dangerous. And actually, these are the situations that women are being led to because there's no consistency or fairness. Well, a home birth does involve a midwife being there with you, so someone who's experienced, who understands the process of labour, who can encourage you through it, and who also, really importantly, understands when things go wrong.
So if something goes
there's
wrong,
also
you are
a lot of
on your own.
You are on your own, and we're seeing an increasing rise in this, again, with recent research that's being carried out. So actually, women are being completely shut out, and nothing is really being done about this.
So well, that's my next question then, because, you know, you're saying there needs to be a change in the law so everybody's all aligned on this. However, that takes time, and there are women watching this that are pregnant right now going, you're talking about me, I need help now. What do they do? What do these women do right now?
So there are lots of campaigns, first of all, at the moment that are trying to put pressure on the government to try and essentially make a consistent law, because as you saw in the videos, women just don't understand how it is that they can meet up with 6 other people from various different households, but actually they can't have their birth partner with them to support them during scans, during appointments, and necessarily be with them during the whole process of labour. That just isn't fair. So the things that women can do is join those campaigns to try and put pressure on the government, and also really, really importantly, understand that we are open, that we are here, that I want to see women coming in. Even if you think that the problem you're experiencing is nothing, please come in or call for reassurance. Reach out to your midwife, come and see us. We are open and we want to help you.
The right of reply from NHS England, they say the priority remains the safety of all patients, their family and our colleagues. In certain areas of the country, the increase in infection rates will require localised responses, and we have included clear steps for how to minimise infection control while still allowing the maximum possible safe access.
Thank you. Thank you very much.
Thank you, and thanks for discussing this subject. It's so hugely important, and I really hope it helps lots of people. Make things change.